are what lead to the health issues. And what we would like is to give up reactive medicine and go to proactive medicine, where we really look at when should the doctor ask you to come in, how can we make sure that there's coordination, that all these things go together. So this really tries to look at the health system embedded in a community. In a community, let's say that for older people, make sure that the sidewalks aren't guaranteed tripping zones to create falls, and where lighting is good, so it's safe, and where there are activities and opportunities for people to engage with each other. So you see strengthening community action. I mean, this is an old model. Nice. We said change takes 17 years. This was introduced, Peter, when were we doing the National Chronic Care Consortium? Remember Wagner came out with this. So this is like 88 or something. And it's really taking hold now. So luckily, Ed Wagner was very patient and willing to stand and fight for this idea, which is a very good idea, which looks at other things, you know. It looks at an activated patient. So the idea we'll be talking about in a minute is not about patient education or compliance, but about helping people know how to navigate this insane system that we have and how to take care of themselves and how to communicate with the activated communities, which you are, an activated community, and then changing the way the practice team in medicine works. This is a whole different kind of a view that we want to move to. And remember, these are on the slides. If you want them, they're on the website. So one of the things we see, we've been having this every decade for a while, Healthy People 2000, the government just came out with Healthy People 2020. And for the very first time, there's information about older people on there, as if we didn't exist. We exist. We've been acknowledged. They noticed. So, and it looks at the same kinds of things, so we're not going to spend very much time on Healthy People 2020, except to say it's on the United States website, so you can find it. And it's looking at the same things. Here we are, same old boring stuff. You got to have healthy weight, physical activity, nutrition, medication management, an area where we do a lot of work. We call it death by cure. If you don't manage your meds, it'll kill you. The fifth leading cause of death, I'm not kidding, the fifth leading cause of death in America is medications. They save you, so, you know, I'm not against doctors and the fabulous science they bring us or medications, but boy, you have to really pay attention. You have to make sure that they're right. Timely medical care, very important. Managing stress and emotions, that quitting smoking thing, and alcohol and substance abuse. So wine is good, but not too much. Okay. So this basically just talks about those same things we were talking about. So I don't want to really go through them too much. Now, our government, and I know governments are not really too popular right now, so I don't want to take a social position about whether governments are good or bad. But I will say here's a good behavior from a government. The Administration on Aging has been really working now to try to look at healthy aging, positive aging. And they have they have 2,600 senior centers across America. They put a lot of our tax dollars out there, and they're trying to optimize how those dollars impact health. Bingo is good, and it does engage people in social activity and some of those things, but the community centers can be really a great place for people to connect and to benefit health-wise, and they can benefit from what we call evidence-based programs. Anybody heard of evidence-based programs? Yes? Quite a few. Okay. I love evidence-based programs because we know they work, and they will meet science in medicine where it stands. It is you have to prove your point, because we're trying to do something here. We're trying to move money that we're putting in a healthcare system. Remember, America spends twice as much as any other country on the face of the earth and probably in the universe. And where are we ranked in our health outcomes? We spend twice as much money on our health system. Any other nation, we're ranked 37th in our outcomes. Makes me mad. And I don't think it's purposeful, but it's reflective of how this system is paid for and organized and the impact of our lifestyles in this country. So the Administration on Aging is joining up with Medicare to say, okay, let's take the dollars we're spending and let's get a much better result. Let's do things we know we can do with good events. So they have developed and fostered, sort of commissioned and discovered a range of evidence-based programs that we're trying to roll out. You think, okay, we all need water, we all need utilities. I would like to see evidence-based programs be like a utility. There are things people can learn how to manage issues of caregiving, and those are actually not on the list, but the Alzheimer's Association, the Caregiver Resource Centers have some evidence-based workshops to help people who are caring for others have a lot of the skills that we need to gain when we suddenly have an adult we love who needs assistance and hasn't before. So these are being rolled out across America. See, we looked at that. Now this is an old slide because now they're in 47 states. The centerpiece of their work is the Stanford University research-based program called Healthier Living, or Better Health Through Better Choices, or the original name, you'll love this, this is a really enticing name. See if you would sign up for this workshop. Chronic Disease Self-Management Program. I want it. Give me 2, please. So that's what CDSMP means. There it is. So we call it Healthier Living. Anyway, it's being rolled out. And in California, actually, Partners in Care is the program office for the State Department of Aging. We're sort of the legs. It's a good thing because they can't hire anybody, you know. They have all these hiring freezes. Federal money comes through them, and they let us staff them. And we're working to take this across California. So Healthier Living is a nice example of the ways that we can help each other, because this is patient activation. It's not patient education. So what's the difference? It's all about people engaging themselves in changing behaviors and setting goals that they care about. Like, for instance, if we said, you know, you should lose 15 pounds. And you can do that by eating differently and moving around more. You say, yes. Now we say, you know, your high school reunion is coming up in 2 months. Or your favorite nephew's getting married in 7 weeks. You're going to want to look hot, right? You just want to look good. So that's the kind of goal setting we mean. And then people develop action plans around those. It's in a peer group, and it's peer-led. So someone doesn't have to be a PhD or some fancy health professional. In fact, sometimes that's a disadvantage, because this is based on asking, so people engage in thinking, and reporting, self-direction, so it's really designed to help. It's very practical. So peers sometimes listen better. Health professionals love to tell you how you can do it. Let me help you out here. I'm going to give you some advice. You say, thank you. Then how much does advice help you? Not that great. I mean, it has its place. But I think the Socratic method and helping people change behaviors around things that are like important to them, that they really want. And some of these are simple, like with really an older person who's experiencing some challenges to their independence. Sometimes it's something like being able to hold a grandchild safely when they visit. That could be quite inspiring. Or being able to actually walk to the mailbox to get the mail. Or some transportation systems will only pick you up at the curb. Being able to walk to the curb is the difference between jail at home and freedom. So basic goals, or goals like you would have. You would have much more exciting goals. Let's see. You could think about a goal. Just think to yourself, what would I really find that would inspire me Maybe I'm looking for, I'm single and I'm looking for some new friendships. Maybe a yoga class would be good. Maybe it's good shopping for a new friend or partner. Let's see. We don't like those bars. So, and the workshop, as I say, is very Socratic. It works around managing the symptoms that people have. It's not going to cure a disease. So if someone has diabetes, although in some cases you can beat back diabetes if it's new. I mean, some of these are reversible conditions. But it helps with, if you've got a chronic condition that's really bothering you, like hypertension. I have such a sweet friend, and he got this hypertension. He's taken his blood pressure like 80 times a day. Of course, every time he takes it, it's going, look at my blood pressure. You know, oh. So these are difficult emotions. It means it scared him, and he couldn't get it under control. So finally he did. He did get it under control. But exercise was part of the key. The meds didn't just do it, and diet. So, but in the meantime, he had difficult emotions, right? These things are troubling. So all these kind of practical things that go into being able to do effective problem solving and setting weekly goals, very important. So from a change perspective, okay, we're working this across California, trying to learn how do you engage people in behavior in less than 17 years? Let's make it 17 months. So now we've been at it about 4 years, and we've got 30 counties with, like Escatón in Sacramento, strong leaders in this. They actually had learned it before, reinvigorated their interest in it, and they're providing leadership in their region, looking for partners like that, people who step up and can help lead their community to adopt some of these evidence-based programs to figure out how to reach out and engage people, because you have to go 2.5 hours a week for 6 weeks, you know, at least 4 out of the 6 to get the benefit. And you have to be able to identify with it. Going into housing sites, Escatón's a leader in that area, or medical groups, or faith-based communities, all kinds of places. But anyway, so we're making progress. But still, we've only got, you know, in California, how many people do you think we have in California who are 65 and over? 4 million, bigger than most states. Go. So 7,400, okay. June, get going. Come on. So if we want to make this a utility. And this is a very respected program. And so what do? Get partners like Cairo. Cairo stepped up.